So, as I say, purpose of today is to talk about care homes, care homes and the remote monitoring system specifically. The idea is to give you a bit of an introduction. This is not meant to be formal training. This isn't us giving you all the information you need. It's about whetting your appetite and showing you how it's going to work in real life and addressing any kind of concerns you've got at this point. And as I say, just as it's a general introduction. You might have heard some of these things before, and some of these slides we've been using in previous presentations, so apologies if you've seen it before, but the scope is really large. I mean, we've got 260 care homes across northeast London with 5,500 beds, operating in very different ways. We've got, formal nursing homes, we've got LD homes, we've got warden controlled settings, we've got very different demographics in different parts of northeast London. So we've got quite a mixed bag, and within that we've also got a really mixed bag of what we call digital maturity. So how much you use technology to support what you do. And part of the overall aims of this group is to try and support care homes in increasing the use of their IT to try and make their lives easier and the outcomes for patients better. So this is one of the linchpins of that, to try and enable care homes to use remote monitoring tools to detect things earlier, essentially. And so this is a summary of all the things we're trying to do, but specifically on the right hand side of the middle, we're talking about remote monitoring today. But these are probably things you've hopefully become familiar with and that the support team have been talking to you about over the last few months, just to try and get everybody on a level playing field in terms of the IT we use across northeast London. So remote monitoring, I suppose, is on its own doesn't really mean very much. And if you want to kind of look at it, if you drill right down into it, remote monitoring's using digital technology to get information from one place and send it to another place electronically without you physically having to both be in the same room at the same time. So in this instance, it will be collecting vital signs or observations, so blood pressure, oxygen, temperature, etc. So rather than what has always been the case before, a doctor or a nurse or another suitably qualified person turning up, doing observations and then having to leave, we can do that using the care home team and then have a conversation quicker, earlier, sooner, more easily, and hopefully that benefits the resident or the patient and the care home staff and the GP or 111 or ambulance service. So hopefully this is useful to everybody. And as I say, the benefits are that you catch things early. We know that, especially in the elderly population, it can be difficult to understand if somebody has got something specific wrong with them. It's, it can be very easy if somebody hasn't got any cognitive impairment and they're able to talk to you and say, actually, burns when I pass urine, I'm feeling a bit iffy, I feel a bit sick. But often it's not that straightforward, and we know that it can be tricky to pick up things early. And the first people to notice problems are quite often the care home staff saying, something's not right. I'm not quite sure, but I'm concerned. And historically, we haven't always been quick enough to pick that up as speaking as a GP. And we know that if you don't pick things up and they start to snowball and somebody becomes more unwell, then suddenly it's an emergency home visit request, or it's a 999 call, or ambulance service coming. If the ambulance service come, it's more likely to result in an A&E attendance, and that attendance is more likely to tend to an admission. So all of those services are suddenly involved. But also, most importantly, there's a person at the heart of that who's unwell, and we could have potentially picked that up earlier. So the purpose of this is that you guys from the care home staff who are around these people all the time are the best arbiters of something's not quite right. And this is a tool to help you understand whether that's true or whether they're actually okay. So the idea is that if you collect this information, these observations, it enables me, the GP, to know and tailor my response better to you. I might be able to decide whether I can come tomorrow or on my weekly care home round, or if I have to come right now, or if I need to call an ambulance. And hopefully that's good information for you to have, and for me, and for the patient, as I say. It says here fewer GP appointments. I mean, there are instances where that's true. So you know, in over the last 20 years, how many appointments we've had just to check a blood pressure, I couldn't tell you. It's probably millions. So that's, you know, and at that time, quite often, if somebody has had to come to the practice and they've got reduced mobility, quite often that means a member of care home staff has to come with them, and we often run late. And so quite often you find that it's a 2.5-hour expedition for you guys and the resident just to check a blood pressure. So this is just an example of how actually using this kit could make life easier for you and for the resident and for us, and result in fewer appointments outside of when somebody's particularly poorly. And more generally, this allows care homes and GPs to communicate in more ways, and I think that's always a good thing. It doesn't replace traditional communication methods of face-to-face and telephone, but I think it gives us more routes to get information passed back and forth between us, and I think that's a good thing. And for me as a clinician, it is useful for me to be able to see at a glance in a care home what the latest set of observations for each of the people are, whether I need to worry about it. You know, for example, if I've got a Thursday afternoon care home round, it might be that we've agreed to do some of the obs beforehand, and then I can decide, or conversely, you might say, actually, I've got 3 people I'm not sure about today. I've done the observations. I could look at the dashboard and go, OK, actually, the first one's fine. I can have a look at them later. The second one's a bit iffy. We might have to come around soon. And the third one's really serious. We're going to have to call an ambulance. So that's, you know, sort of what we're trying to get out of this. We're going to go through this in the demonstration in more detail, but essentially your role in this is taking vital signs, when I say in the usual way. For those of you that aren't familiar with the process, we'll have to train you and explain, and in addition to using the app itself. But the purpose is that you take the observations, it goes into the app creates a score, which we'll come on to in a second, and then that score helps us talk in the same language. So rather than talking about, well, something's not right and it being quite non-specific, we get into, actually, the news score is 4 and the respiratory rate is this, and that's why I'm worried. So it's to augment what we already do, because you guys know very well when somebody's well and not well, and it's not to take that away, it's to help us have an additional way of communicating in a common language, and it saves time. So that's essentially your role, is creating the scores and then having the conversation. So normally in the past, you may not have done the scores, we would have had the conversation, so that's not going away. It's just giving us extra information in our armory. So the reason we're talking about this today is because we're getting to the point where we're ready. This has taken a long time for the app to be developed. We've had it made bespoke for North East London, and no, it's not perfect. Yes, it will improve. Very open to comments and suggestions, but what we have done is tested it and it works. It's safe and we're confident that it does the job that it was designed to do. So perhaps it won't win any prizes for looking glossy, but it's good enough. And I'm hopeful that you'll find it useful. So in preparation for the deployment, in addition to sending out the tablets and the equipment to take the observations themselves, we also need to get you guys understanding what this is going to look like prior to having the formal training that takes you through exactly how to do each step. So this is the first part of that before we go live, and doing the same thing with the GPs in the same cohort, so that both you and the GPs are clear about what's coming up next and give you a chance to talk about it. So I've mentioned News 2, and Restore 2 is another one that you'll hear about, and for some of you that may mean nothing. You might be using it regularly and be quite confident with it, and that's okay. Hopefully, I'd like it as many of you to be teaching to suck eggs as possible, because it makes our job easier, but I'm expecting that this will be new information for quite a lot of you. So NEWS stands for National Early Warning Score. It's been used in a hospital setting for a long time. It's also been used in the community for the last few years. So we know there's good evidence over a long period of time that taking people's observations and scoring them is a really good predictor of what happens next. So the higher your score, the more sick you are likely to be, and the more attention you're likely to need. And there's more behind that. You can have a news score and not be too sick, but it's quite unlikely. Likewise, you can still be sick with a news score of 0, which is the baseline. But again, it makes it quite reassuring to know those observations are normal. So what the app will do is it will turn this grid into something you can use that's much more user friendly. So rather than expecting you to know all these scores and have to calculate them themselves, all you'll need to do is put in the information. So for oxygen, you put on the pulse oximeter and it'll tell you the number, and you just put in the number 95, say, and it'll know that that's okay or not okay. So that's the purpose of the app, is to help us to communicate, because if I know that somebody's news score is 1, then that makes me think, okay, they're not quite right, but I'm not too worried. Whereas if their news score is 9, I'm going to be saying, call an ambulance. It's unlikely this person can wait for me to get there in an hour or 2. And if it's 2 or 3, then we'll look at the dashboard together and come up with have a conversation about, can this wait till this afternoon, tomorrow? Is this a gradual decline? What's the background behind it? So it enables us to have more information. However, these are just numbers at the end of the day, and there's a person behind it. And this is never to replace your your experience, and it's meant to augment what you already do and what you know. So the second part of this is perhaps just as useful, perhaps even more useful for you guys, is the restore bit. So when they took this from a hospital setting and put it into the community setting, they recognised that actually, if people that are using this are not necessarily 20 years, you need to have something that's a bit more subtle that you can use, and that's where restore comes from. So somebody shoehorned in restore to stand for recognise early soft signs, take observations, respond and escalate. But I'm pretty sure that that was just so it fitted the words neatly. So I don't know how well this displays, and I'm getting some background music. Sel, did you want to just try and mute everybody apart from me? So thank you. This is a list of questions, which are the sort of things that you'll be having in your mind when you see somebody who's not quite right. So they're called soft signs because they don't have a number attached to them. It's your view on the situation. And people can often tell you these things, but sometimes they can't. So if somebody's in pain but can't communicate that with you, they might just present as a bit muddled, or they might go off their food, or they might be what people often say off legs. They're just not moving around as much. And those are soft signs. Those are you saying, this person isn't at their baseline anymore, something might not be right. And you can still have this, and actually there's nothing wrong, but the more of these things you start ticking off, actually they've not been to the toilet this morning, now I've thought about it, they seem more tired than usual, actually you start to create a picture that we can use to communicate together when you give me a phone call as the GP. So in the setting that we're going to go through in a second, the situation is that you've just done breakfast, and actually Mrs. X hasn't got out of bed this morning, and you try to prompt her to have breakfast in bed even, and she won't eat, and she's being a bit agitated, but doesn't really know, isn't able to really communicate why. That would be a really good time to prompt, because you've got some yeses on these questions set. Why don't we do a set of observations and calculate a news score? And then if that's 0, okay, that's helpful, that's reassuring. If it's 4, then we think, okay, that's substantiated my concern that I think something's not right with these soft signs, and the numbers are looking a bit iffy. I should have a chat with the GP. And I said, we'll go through that in a second. And to help you have that conversation, there is a tool called SBARD, and that's been around in medical settings for a long time. SBARD is just an acronym, and it's called Situation, Background, Assessment, Recommendation, Decision. So the situation is what's happened. So the one I just gave, Mrs. X, not got up this morning, not eating and drinking, seems a bit agitated. That's the background. Hopefully in the meantime you've done the news score, and you can say a news score is 3. The background is actually normally she'd be up and about and she'd have made her own breakfast, and is normally quite chatty. So you can see there's a change in the baseline. And then what have you done about it? Okay, well, perhaps we've done 2 sets of obs over a couple of hours and monitored it, or it might be that you've given her some pain relief to see if that made any difference. And then the recommendation is, so based on that, I'm worried, I would like you to organise a visit, or give me your opinion about whether we need to call an ambulance or something like that. And then the D, the decision, is the outcome of that conversation between you and I, or 111 and yourselves. And that enables you to put down in writing, okay, so at the end of that chat, we're going to do this. You're going to come and visit at 2 o'clock today for the care home ward round, and you're going to see Mrs. X, would be an example of the outcome. So this again is all plugged into the app, but I'm just demonstrating, going through in advance why we're doing it. So that's the end of me talking through the background and the principles of it. And then what I'm going to do now is do a bit of a demonstration. So what I'm going to do is the first one is a GP bit. So let's say Mrs. X has just come to the care home and you've let us know. I'll add them onto the system and you can watch me do it. Because I think it's useful for you to understand that bit of the GP bit. And then what we're going to do next is go through the app itself and taking some observations and undertaking an SBARD, so that conversation part. And then at the end, I'll go back to the GP side of things, and then you can see the dashboard, so you can see what the GP sees, and then we'll have time for questions. I'm not clever enough to screencast my phone and do this presentation at the same time, so that is a video. And the sound doesn't play through, so I'll just talk over the video, but it's only 2 minutes long and hopefully it's useful. So I'm just going to stop showing this screen and then start showing a website. And hopefully you can't hear the dogs barking in the background, but the delivery man has just arrived. So hopefully now you can see the web page.
Yeah.
If you can't, then tell me, because hopefully you're watching me logging in. So this is the web page that you can see and the GP can see, and they look slightly different. And what I'm going to do is just add a new patient. Hang on, I'll just fiddle around to get the details up. So this is a test environment. So and we've been adding and removing patients quite a lot. So actually, I've done it in the wrong place. So if any of this doesn't go quite right, that's my excuse. So normally what will happen is you put in a NHS number, which is a test NHS number, and you'd put in the patient's date of birth, and then click on the Find Patient. And what it should do is pull that through from the spine, from the NHS spine. In this case, because it's a pretend patient, it's asking me for some additional information, but I'm going to ignore that bit and just activate the service. So I'm reactivating because we've done it before. So I'm going to turn him back on. And then we're going to activate the News 2 service. So don't worry about this bit. This is just me demonstrating when the GP adds a new resident. This is the process we'll go through. So I think I'm supposed to be the Lawns Care Home in this situation. So I'm meant to be adding it for the Lawns Care Home, and I'm meant to be from the Bishop Street practice. And then this is just where the emails are going to go through at the end. And then would I like to set up some regular monitoring? So let's say that Rocky is a new resident and I've not met them before. So I think, and you think it would be helpful for us to do some observations for the next 3 or 4 weeks. It turns out they've just started a new blood pressure medication and we're not sure if we need to adjust the dosing. So let's say we're going to do it weekly for the next few weeks. So I'm going to say yes to some scheduling. And I'm going to say it's going to be weekly. And I'm going to say, because I do a care home round on Thursdays, that we'll do it on Thursdays. The time is pre-populated as 7 AM. It can be any time. It's more just so that when you guys come in on a Thursday morning, the app will know that it's due on a Thursday by the time you started your shift. That's all changeable. So what this will do now is say once a week on a Thursday morning, it'll prompt on the app to do some obs until we turn that back off again, which we can do at any point. And then it'll start asking some more specific questions. So the News 2 bit, the 2 is because there are 2 scales for oxygen. Most people are on scale 1 unless they've got COPD. So I'll leave that as it is. And then there's some optional information that the GP can put in here that might be useful for you guys if and when you need to use the app if somebody's poorly. So this is optional, it may or may not be put in there, but it might save you some time. So if, for example, the resident's got a CMC, a Coordinate My Care plan, then it's worth you knowing that, because if you have to phone the ambulance service at 3 AM, they can then look that up if they know to look, whereas if you don't tell them, they won't know to look. So that's just a tick box. Likewise, it's useful for everybody to just know in advance, is there a DNA CPR for this person? So we can say, yes, this person's got a CMC and they've got a DNA CPR. And if you want to, you can put the medication list in here. I suspect most GPs won't, but let's say they want the world to know that warfarin is one of the medications they're on. They might just put in the high risk one so that people can comment on that, because if someone bangs their head and they're on warfarin, that's more concerning. So anyway, these bits are not essential, but additional helpful bits. And then probably won't go over to this bit now, but you can fiddle with this settings. So this is the default, and you can change it. So if, for example, you know that one of your residents always has slightly low blood pressure, let's say they've got heart failure, and we know that blood pressure is always a bit low, you can tinker with this, or the GP can tinker with this, so it doesn't keep triggering scores inappropriately. But for most people, it'll be left as default. And for today's example, I'm going to leave it as default. So I'm not going to change this threshold. This is just a summary of what I've said. And that's it. The patient is now active. So what I'm going to do next is then show you a brief video, and I'll have to narrate over it, as I say, because the sound isn't working. So let's now say the scenario is so I'm the GP, I've added this patient, some time has elapsed, and so, Rocky is not feeling so well today, and you've seen him and you've thought, I'm not sure, what shall we do next? So that's the scenario. While I pull up this video. So again, hopefully this video is displaying. So again, tell me if it's not. So this is an equivalent of the app that you'll be using. This is it was recorded on a phone, on an iPhone. It'll be on tablets for you guys, but it'll be very similar. The layout looks like this. So this is a list of the people in the care home that have been added, and you can review at any point. There's various different bits within this, but the trainer will go through this. But the point of this is that at this point in time, you've got a list and you think, Rocky's not right, what should I do next? So I have to just check that the person that was narrating this that I'm covering for, because you can't hear it, is going to do the same thing. So this person's gone, aha, here is Rocky Laverty on my list. I'm a bit worried about them. I know what I'm going to do. I'm going to do a restore to. So I'm going to ask those questions of Rocky, of myself, and we're going to go through those together. So there's a couple of other bits in here, like you can request a video conference through the app, and there are some other bits, but for this bits and pieces, we're going to do a restore to question set. So we've selected the question set, and he goes through this quite quickly, so I'll pause it again. But this is the slide I showed you before, the person with the questions next to it. This is that in a different format. So in an ideal world, what you would do is you'd go through each of these questions. So in this setting, Rocky's breathing doesn't seem right. So we could say, oh, actually, they seem a bit breathless. I'm not quite sure. That doesn't seem right. So they've said yes to shortness of breath. And they've also said, because this is a nursing home in this scenario, they've added some oxygen because the oxygen saturations are low. And then they've gone through the rest of them and said, no, they're not clammy, they're not tired, they don't seem confused, they don't seem to have a fever, no one else is concerned, they're still walking around. He's going through these quite quickly because he's already thought about them. But basically, he's gone through the questions, have gone, at least one of those is positive because the breathing is not right, and because it's a nursing home, we've added some oxygen. So because at least one of those questions is a positive, it takes you through to calculating the new score. So the actual, the number, and it does that for you. So you put in the numbers and it gives you the result. So he's gone through, he's put in the respiratory rate, and actually it's gone down. It was 20 and now it's 9, I think. Yes, 9. And the oxygen saturation, which was normal at 96, is now 90. And the rest of the observations for this are still the same. So once you've done your new set of observations, you then calculate the new score. And in this case, it says it's 4. Now, you'll come to know this, but 4 is a middling concern. So 0 is fine, 9 is really bad, 4 is something's definitely not right with this person. So at that point, it will start to prompt you to do something else. So it's just summarizing why it's calculated the score, and then it's got a message for you. So it says, okay, if somebody's got a new score of 4 and you're worried, then you should do them again in 30 minutes. And if they continue to be more than 3 or above 3, then you need to speak to the GP and get a telephone or a face-to-face review. And if it's getting worse, then you need to escalate it. So that's the message, because it's got a new score of 4. So that's useful information for you guys. Go, oh, okay, there is something wrong with this person. You can do some extra bits and pieces, so, but we won't go through all of those now. So because we've got this new score that's not normal and you've got some advice to do something about it, you can choose to do an SBARD assessment. So that is that structured discussion between you and the GP or you and the ambulance service. You don't have to do it, but it's helpful and it's a written record of what happened next. So in this case, we're going to do an SBARD assessment for Rocky. And to try and help that conversation along, it helps you fill in some information in advance. So one of the questions is, well, what's changed? If their normal news score is 0, it's now 4. That's useful information. And you can say in advance, before you phone anybody, just to help you form your thoughts, what are we worried about? And in this case, they're worried because their breathing has slowed down and they need oxygen. And just a bit of information it would be useful to share with other people. So you know they've got dementia, so you put that in there. They don't have a DNA CPR, actually. And they've had some ibuprofen earlier today. And in your opinion, things have changed over the last hour, so quite recently. And I think the problem is, okay, wait, you can catch up with me. So over time, they seem to be deteriorating. And in this instance, the actions they've taken is because it's a nursing home, they've put on oxygen, which is something they're able and trained to do. And then the recommendation is, what do you want to happen? So this is, up until now, you've been populating this with your thoughts to help you form your thoughts before you phone the GP. So what do you want? What you want is, you want me, the GP, to phone you back as soon as possible. So you phone me, and now we're having a conversation. And at the end of that conversation, I say, okay, I'm going to come and visit. And I'm going to come and visit by the end of today. I'm in the middle of clinic. I can't come right now, but I've got the care home round this afternoon. So I'll be there by 4. In the meantime, we've agreed that you'll keep an eye on the patient with repeat observations. And if things get worse, or sorry, if things don't get better or they get worse, phone 999. Or if anything changes, phone 999. And then that is a written documentation of what we have discussed. Now, it's important to just pause on this bit, that the discussion is the important bit. That you and me talking and coming up with a plan together is the important bit. The new score is just a number, it's a tool, but us talking about how we're going to plan is the important bit. And the SBARD is just a way for us to have that conversation and to record it. You cannot replace that conversation with this on its own. So that's what this orange box is saying, is that if you just did this and clicked send, I won't necessarily read that for several days. It goes into a generic shared inbox that I may or may not notice. So make sure that this is as well as calling the right people, not instead of. And that's just, it's important to note that this is, as I say, it's a tool, it's not a replacement. And that is the end of that video. So last thing I'm going to share, and I'm going to stop and open it up for questions. Is just to come back to the website, and let's say it's an hour later and I'm now having a look at the care home before I come around to my care home round. So just to give you an idea of what the GP sees, annoyingly, Rocky doesn't appear on this list because we've just fiddled around with the settings. But what you can see is this is for the care home, all the latest set of observations that have been done. So some of these were planned in advance and some of these were taken because somebody was poorly. And so you can see it's traffic lighted. So the green ones are fine, the amber ones are not quite right, and the red ones are concerning. And then I've got, at a glance, I've got a news score. Now, because this is trading, they all look terrible. So all of these people would need immediate action. I might get away with this person's news score is 3. I might be able to say, okay, that can wait till tomorrow's round unless it changes. But the person who's got a news score of 10 above, I would be saying we need to phone an ambulance. This can't wait. So that is really useful information for me to enable a conversation with you guys quickly and easily to try and identify who needs help and when, and make sure these people get the best care they can. So that, I think, is probably more than enough yakking on from me. Hopefully that's a useful summary of what we're doing, why we're doing it, and a little bit about what it looks like. So I think I've stopped sharing now. So I don't know if anybody has any questions they want to ask, or queries or clarifications. Does it make sense?
Someone's got to have a question. You can't all be that happy. Elizabeth, you're on mute, my love.
Hi everyone, it's Elizabeth O'Donovan from Vibrant, Wood Lodge. I was just a bit, I missed the bit then where you were saying that this is, you have to do something else, not just rely on that piece of information. Could you just go over that bit again, please?
Yeah, sure. So what I was trying to say is this is a tool. So it's something to help us, but it doesn't replace having conversations. So because the risk is that you use the app and you click it all and you press submit and you think my job's done. Actually, that doesn't work. You still have to talk to somebody. So what it does is it helps you have a better conversation, because you can go, okay, well, I've gone through my checklist of questions and they're agitated and they seem in pain and they haven't eaten today. Great. I can now say that to the 111 team. And the news score is 3, and then you have that conversation, what do we do next? Whereas if you just press submit, nothing will happen. Nobody will know about it.
Yeah, okay. Lovely, thanks.
All right. Any other questions? Or concerns? I'm very happy to try and talk about if you are worried about it or doesn't make sense. Mohammed?
Okay, we've got a question in the chat. Sorry. Oh, is Mohammed got his hand up? Sorry. We'll go after.
Yeah.
Hi, I'm Tripti. Mahmood is also with me, so we are attending this together. I'm from Ferris Road Manager here, and Mahmood is Senior Support Worker. Just to be clear, my understanding is that the patients will be registered by the GP, and we will be able to see them when the app is ready or it's completed. Am I right?
Sorry, can you say that again? I didn't quite hear my.
That's fine, I got it. So okay. The question was, who has to add residents onto the system? And it's the GPs that do that. So at the beginning, depending on how big the care home is and how many care homes each practice has, we might have to do that en bloc, and in healthcare might help us do that, the app developers. But let's say we've done the initial onboarding and somebody moved in this week. You would give us their details and we, the GP, would add it, and then you'd see it on the app.
Okay.
All
right. And do we know when the app will be ready for us to use?
I didn't catch that one. Do we know when?
When the app will be ready for us to use?
So Zelda, I think we'll have a better idea of the timelines. I think all the hardware has been developed, been distributed, and I think we've got a plan for go live quite soon. When is it, Zelda?
Yeah, so if you're in phase 1, we've got a go live date of the 19th. We are about to send you. Have you received your hardware?
Yes.
Yeah, okay. So what we will be doing shortly is sending you through a welcome pack.
Okay.
Okay, so when we send you through that welcome pack, there'll be training sessions on there that you will need to attend. So you will need to attend that training session. Once you've attended the training session, or you've gone on the website and looked at the videos and you've sent us confirmation, we will send, in healthcare, we'll send you login details and passwords.
Okay.
Then, yeah, you will get that, and then you will get, we will give you websites, web addresses, everything, so that you can download the apps on the tablets, and hopefully you can set up the tablets. We'll be providing hourly, daily workshops for five days a week for 1 hour, where you can come in and ask for some help and technical support. And get even further training or assistance if you need to, and then you'll be able to go live and use it. So from the 19th is just going to be the deployment, getting everyone set up so the GPs can onboard the patients like what Ben has explained, and for you guys to download the app and attend training. Is that okay? Is that clear?
Yeah, thank you very much. Thanks, that's clear. Yeah.
Okay, the next question from Baker's Court colleagues is about frequency of observations. So that's going to really vary on quite a lot of different things. So you guys who are you a nursing home, I'm guessing, might do it much more frequently, and you don't have to record it all in the app. So it might be more convenient for you to start recording your obs in the app rather than putting it in more than one place. But that's entirely up to you, and you can have that conversation with your GP colleagues to work out what system's going to work best. So that's fine. You can set the frequency to however often you want. You can have it as never having routine obs, or you can have it as daily, hourly, anything in between. So it's completely up to you, and that's individual for each resident. So you can have some patients on hourly obs, others on daily obs, others on weekly, and others on none. So it's entirely up to you, and you can have that bespoke, and it can be changed as often as you like. You can print them off. I'm not sure how well it'll display compared to what you've got now. So again, that's a decision for you guys to make about, does that look good? Would I rather stick with what I've got? Because I don't know your setup. So yes, you can print obs, but again, it's up to you how you use this tool and how much you want to use it. The final thing is, even if you've got timed observations, so if you've got twice daily for COVID, everybody who's registered can have a set of obs done at any point if you're worried.
We've got patients.
Hello, everyone. Yeah, my name is Patience. I'm from 80 Gascon Care Home. I think some of my 2 questions, you've answered them. But my main one, when we do all these recordings, the last part you showed us, whereby we will be inputting, you've called me and then we've discussed this. Is the waiting time. Let's say if we are to doing these observations, let's say in the morning at 7 o'clock, the GP, the waiting time, how long is that going to be? Because at the moment, we struggle with GP callbacks. Sometimes they call maybe 8 hours later. So do I still need to wait for that period until I input the last bit?
No, that's a really good question. So if you're unable to get through to somebody, then you don't have to get to the end bit. You can either choose not to do the SBARD at all, or you can save up to that and you just didn't do the D, the discussion, the decision bit. But you might think, actually, this can't wait. So if you don't get a call back in a reasonable time, you can still take other actions. This is, like I said, it's a record. So in an ideal world, yeah, you'd phone me and I'd pick up straight away and there'd be no delay. This is going to require some changes to the way GPs work as well, because there's no point if you guys phone up going, this new score is 6, and having to wait 8 hours for a phone call back, because that's not safe. So there's going to be a dialogue between yourselves and the practice about how you communicate. It might work brilliantly already, it might not. That's part of this experience. If we start picking stuff up early and we don't know what to do with it, then that's for us as a group to come up with a plan. But you could always, for example, let's say somebody had a new score that was high, and you'd asked for a call back and it's been several hours and you're still worried and they might be getting worse, then you'd phone 999, for example. So it doesn't ever replace your other options. It's as well as.
Oh, okay, thank you very much.
Someone had their hand up. Esther.
Oh, yeah. Hello, good afternoon. Yeah, my name is Esther from Saffron Care Homes. Yes, we receive our tablet, but it seems not to be charging, or when you put it on, nothing happens. So, yeah.
Okay, so we'll put our one of the team will put our email in the address, and then we're in the address in the chat, and we'll contact you, and we'll try and do a video call to see what's going on there.
Okay, then. Thank you.
So if one of the DSOs, can you take Esther's details, and then we can contact her. Oh, Esther, our email address is in the
chat box.
Yeah.
Okay.
So if you your contact details in there, we do a one-to-one video call with you to see what the problem is there.
Sure. Thank you.
Okay.
Any other questions, queries, worries, things I want to check in on? Elaine? So Elaine, do you want to come in? And the answer is when you start using it is we'll let you know from the 19th when we're doing the training. We have to make sure that everybody's set up first and knows what they're doing, and then once we've done that, it would be go live from the 19th. But Elaine, do you want to come in with a question?
You're on mute, Elaine.
Our microphone's not working. Sandra, the 19th is the start of the go live date. It's not the only one, so don't worry. There's a rolling program of training and starting this up. So I think what will happen is the relevant support officer will be in touch with each of the care homes to set out when each bit's happening. Is that right?
That's completely right. The 19th is just basically the start date. We're going to have training ongoing. The first week is probably about logistics, getting you set up, making sure that you've had the training, making sure you've got your logins, you can log into the app and all that sort of stuff. So not to worry, it'll be ongoing all the way through.
The tablets should have been sent out, shouldn't they, Zelda?
Yes, they should have. Mornington Hall, Elaine, are you in phase 1 or is one of the DSOs? Who's responsible for Mornington Hall?
I am.
Okay.
Yes, they're in phase 1.
Yes, we have received the iPads already.
They're tablets, they're not iPads.
Yeah, they're tablets. Yes, we've received them already.
Oh, okay.
That's great.
Thank you.
Yeah, I think if you're in phase 1, everybody should have had their hardware, so the tablets, but also the other bits and pieces to do the observations. Is that right?
That's correct. Yeah, you should have received your blood pressure cuffs, your pulse oximeters, your tablets, and possibly your chips if you needed a chip for your tablet. A letter that was in the box. You're saying no, Sandra. What? You didn't receive anything? You're not in phase 1? She's typing. Not got a chip. Yeah, so you wouldn't have got a chip. You would only have got a chip if you would have needed one, if your Wi-Fi around the home isn't good enough. So that's the only reason why you would have got that. It's dependent on your digital maturity within the home. So that's why. Thank you, Sandra. Hey, yeah.
I've got a feeling Esther and Elaine's hands are old ones. If you've got another question, let us know. If not, drop your hand down. Sandra, did you have another question?
Yeah, the Wi-Fi in both houses that I manage is actually rubbish. It's poor even for our computers. Now, I did receive the packs last week, and we've had a look at them and can't work out how to set them up anyway.
Right, so what you do, and this is going to be for everybody, if you do not know how to set them up, or you do not know what to do, what not to do, then please contact the email address that was with your letter or that is in the chat, and one of our team will respond to you, and we'll go through it in the workshops, and we will go through it on one-to-one sessions. Is that okay?
So, has this been set up so it's literally one person rather than a number of staff that will be doing this? Because obviously the staff that are going to be doing this are the ones that also need to be trained.
Yes, so the training sessions will be done via Teams. There'll be video sessions, there'll be training sessions. So anyone who's going to use it, it's down to the managers to actually let the people come in and sit on in the training, and it's every day, daily. So you know, you can have 2 staff come on a Monday and then the remaining staff come on a Wednesday. It's up to you.
Okay, thank you.
That's all right. I think that's an old hand. Is it Esther? Yeah, I think it is.
Okay, any more before we wrap up? Otherwise, Selda and the team are available to answer any queries you've got after this. This is just the beginning, it's not the end. So don't feel like after this you should know how to turn it on, do it all, run through everything. That's not the purpose of today. This was just literally a show and tell to whet your appetite and hopefully help you to understand why we think it's a good idea. I hope it goes smoothly. I'm sure there will be bumps in the road, and we all have to be a bit patient with that, and also recognise this will get better over time. So this is, as I say, the start of a journey, and hopefully it's going to be really useful for you, for your residents, for me as a GP, and hopefully it'll be, we'll look back in 6 months and go, why didn't we do this sooner? That's what I'm hoping for, but we shall see.
It will be. So don't forget, everyone, just to add on to what Ben's saying, please do contact us through our email address or through your DSO if you've already got a relationship with them, and someone will get back to you and contact you, and we can answer any queries and tell you when the training is, etc. You're not going to be left on your own. And Dario's just put it in the chat again. Okay.
Right.
Thank you.
Well, thanks everybody. We'll be in touch.
Thank you.
Take care. Thank you, everyone. Bye.
Bye.
Bye.